Hi, let's talk about Joule burn. So, this is a topic under forensic medicine where we will talk about the definition of the Joule burn, the mechanism, how it's happening, then some forensic applications. Okay, so let's begin. As you can see here, I have written the Joule's law. You might have already studied this, that H equals I square RT. What is H? H is nothing but the heat generated. Now, why is this heat generated? Because you take any conductor or any insulator, there will be some amount of resistance. So, electrical energy gets converted into heat energy because of that resistance. Okay, and not just the resistance, it also depends upon the, as I have written here, the I square. I square is nothing but the current and the time, the duration. So if the resistance is more, or if the current is more, or the time duration is more, so whatever it is, if there is increase in any of these components, there will be increase in the heat generation. Okay, and the current depends upon the the difference between the voltages. Like if there is high voltage here and if there is low voltage here, that difference causes the current to flow. Okay, so that we understood. Now coming to the definition, like for the forensic aspect, what is Joule burn? It is a specific type of burn injury caused by the passage of electric current through the body. Now, because the current is flowing through the body, where it is flowing, from where to where? So, from the high voltage to the low voltage. Ground is always low voltage. Okay, that is the earthing we say. That is the potential is less there. So, because of that reason, if there is high voltage traveling from across the body through the different parts, as you can see here. So let's suppose this is the person holding a 240 volts of source, and the current is flowing through this pathway or this pathway, or maybe this pathway also it can go. So it depends, wherever the shortest pathway the electricity finds, that will be its path. Okay, there can be multiple paths also. So as you can see here, the current is entering from a point and it is exiting from a point. Okay, so that is one of the characteristic of this kind of Joule burn, that it has an entry wound and it has an exit wound too. Alright, now if I talk about the mechanism of the burn, why is this happening? So the electric energy which is traveling through this person, so the first point of contact is his skin, and skin has high resistance. Okay, compared to the nerves and other deeper tissues, skin has very high resistance, and as we know through this formula, if there is high resistance, more amount of heat will be generated. So there is extreme heat generated at that point, at that time. Okay, so as the point of contact is skin, there will be entry through the skin, that is called as the entry wound. If you can see here, because of that resistance, there is heat generation which causes localized burning at that point, and the current always tries to take the shortest path. Alright, because it does not want to waste any time to reach to a stable state from high voltage to low voltage. Okay, so look here. As you can see here, so this was a patient who had holded a wire or something, and from there you can see the mark here, right? So this mark shows the entry point. So from this point the electricity entered in his body, and you can see the exit point. See, the exit point is large, irregular and split kind of, right? It looks like something exploded at this point. So this is one of the example of high voltage trauma. Okay, so for the appearance, entry point is small, well defined burn, gray, white or charred crater with raised edges. So everything matches here to the point, whatever he is trying to say. It is gray, white or charred crater with raised edges. You can see here. Alright, then exit point. Exit point is, as you can see here, it is multiple, irregular, there is some slits kind, okay, and exploded appearance. Alright. Then coming to the features, it is dry, leathery or blackened. No blisters is formed. Blisters is formed in the burning injury, like thermal burns. Okay, as you can see here. So this is the normal tissue. First degree burn, there is no blisters, but in second degree burn, there is some blisters. So as you increase the degree of the burns, it enters into deeper layers. So fourth degree, it enters until the bones and muscles. Okay, bones and muscles also gets burnt here. Okay, so in third degree burn, you can see burns involves all the skin layers of the skin. So all the layers of the skin, the dermis, epidermis, okay, it gets burnt. In secondary, there is blister formation. So features are dry, leathery or blackened. No blisters is formed here. Depth can be superficial to deep, like the third degree burn. So third degree burn, it depends on, if it can be superficial also, it can be deep also, right? That depends on many circumstances here. Alright, so we have seen this also. So we understood the mechanism, we understood the appearance too, and let's talk about some forensic significance. Like, what is the forensic significance? So the first thing is diagnosis. If you can see any Joule bonds, the entry and the exit wounds, then you can confirm, okay, this patient is dead because of some electrocution. Okay, so yeah, the entry and exit wounds indicates the current path. Example, hand to foot. Okay, and not just hand to foot, it can be from anywhere, right? It can be from head to toe, from this arm to this arm, from ear to ear. There can be many paths. Okay, it depends on, again, the voltage difference. Manner of death, it can be accidental because of the faulty wiring in the maybe home or something. Suicidal, it can be because he was trying to end his life. Or homicidal, which can be forced electrocution. Then what about evidence? Scene finding, example, damage. If you find damaged wires or appliance marks correlate with burns distinguished from the lightning burns. This lightning burns, you can see it. Now here is a term called as filigree burns. What is filigree burns? You can see here nicely, it is kind of a tattoo mark, right? So this fern like appearance. And now okay, the thing is, why it is called as filigree burns? Because when I googled filigree, it showed that the word filigree comes from jewelry. Like, you can see the metal is so finely carved into intrinsic patterns, and these patterns are called as filigree patterns. So similarly, this also called as filigree patterns, okay, or the fern like pattern, and this happens due to the lightning. So if you can see filigree burns, that means it is not electrocution. Okay, filigree burns is due to the lightning, and if there is thermal burns, there will be widespread charring or the blackening. So cause of the death, what is the cause of the death? Cause of death is usually the cardiac arrhythmias. So as you can see here, that the electricity is also passing through the heart. So if there is excessive electrical impulses, then obviously it will cause arrhythmias, because heart cannot regulate so much of electricity at one point. Okay, also there can be respiratory paralysis and not the burn itself. So not always the death is occurred because of the burn, but it is occurred due to electrical arrhythmias, respiratory paralysis. Alright, so we are done with the definition. We understood little bit from the physics concept. We understood what is entry and exit wounds. We understood there are different paths. Then we understood why is there heat generation. Okay, then we talked about the appearance. We talked about some concepts from the burning also. We talked about the forensic significance. Okay, so that was all. I hope it was short and sweet. This question is usually asked in university exam for like 3 markers or maximum 5 markers. So yeah, that was all about the video, and we will discuss something else in other video. Okay.